It's March 29, Ukraine Media Center Ukraine Forum starts its operation. My name is Svetlana Cheparenko. Now we will be talking about the efficient treatment of tuberculosis and which modern treatment methods are free and available to patients in Ukraine. Our guests today are Ihor Kuzin, Deputy Minister of Health, Chief State Sanitary Doctor of Ukraine; Yana Terleieva, Head of the Tuberculosis Prevention and Control Department of the Public Health Center; and Darina Lewandowska, Active Director of Cherkasy Regional Tuberculosis Hospital of Cherkasy Regional Council. Good morning, dear guests. So, Mr. Ihor, there is information available that the tuberculosis cases are growing all around the world. What is the situation in Ukraine? Do we have the same negative dynamics? And how generally can you describe the situation within the last 2 years of the full-scale invasion? Well, basically, if we check out the global trends, the number of cases all around the world has grown at least 4%, and judging by the number of little cases in Europe, probably for the first time within the last maybe 15-20 years, then these figures started growing as well. And there is a reasoning behind that, because COVID significantly influenced the readiness of the patients to come to the family doctors and to use the healthcare services in general. The symptoms of tuberculosis may be similar to those of COVID. This is why people in the beginning of the pandemics, they were afraid, and that's basically the global trend. And currently we're witnessing some remote consequences of COVID pandemics, which is a problem for Ukraine as well, because Ukraine was among the leaders in terms of new cases of tuberculosis, both sensitive and multi-resistant. Multi-resistant tuberculosis is the type of tuberculosis that is not cured with standard treatment methods. So yes, for Ukraine, this problem is even more present, because in Ukraine there are some complexities in terms of security. It's not always that we may launch the full complex of preventive activities, and now we document the increased number of cases of tuberculosis. So if we check the statistics, within the last year, Ukraine documented more than 20,000 cases of tuberculosis, including 640 cases documented in kids. Yes, among the kids we also document the growth of this number. At the same time, currently in Ukraine we have the sufficient number of innovative approaches and opportunities to get some modern up-to-date treatment, and for a number of years Ukraine works under the newly updated protocols of WHO. Our prevention methods, they are in compliance with the best European and global standards. For example, if we take multi-resistant tuberculosis, previously the treatment was taken 18 to 24 months. Now, thanks to the use of innovative treatment methods, we have an opportunity to cure patients within up to 12 months, 9 to 12 months. There are changes to the approaches of hospitalization. A lot has changed in diagnostic procedures. So currently the healthcare system, through the National Healthcare Service of Ukraine, has a branched out network of pulmonological centers that provide specialized support and aid, and this service is also available at the basic link of the healthcare system, where the family doctors can accompany the patients sick with tuberculosis. Actually, there's a lot of stigma around tuberculosis, and using this opportunity, I would like to urge all of the Ukrainians to find out more about the basic symptoms of tuberculosis, to find out where should they go to if they identify such symptoms. And I want to reassure everybody that the system is currently capable of providing them with high quality and free aid to make sure that those patients get back to their everyday lives in a normal manner. So what is the easiest way to prevent tuberculosis from the early childhood is vaccination. So what is the situation with the vaccination of kids in Ukraine? Well, the vaccine is used within the within the first month of life of a person, and in 2023, unfortunately, Ukraine has not achieved the vaccination rate of 95%. We observe different pictures in different regions, but average is 85%, which is the best result in Ukraine. And at the same time, I want to emphasize that this indicator is calculated by the number of population that is official according to the numbers provided by State Statistics Service. So basically the real coverage of vaccination is a little bit higher. That's why, yes, vaccination should be assigned for a child as soon as possible, right after the birth. And the problem that we're seeing most frequently is the refusal of the parents. First of all, due to the fact of the lack of understanding that the vaccine really protects a child and that use of the vaccine is of advantage in future prevention of development of tuberculosis with kids. You've mentioned that currently Ukraine uses the most up-to-date practices of tuberculosis treatment, which result in shorter treatment periods. Can you please tell us more about those practices? What are they? What is the global experience that we employ? Well, I would rather stop at BPAL scheme of treatment, which is a recommended one for us for the time being. It's recommended by the European Office of WHO. It's used all around the world. It's basically innovative treatment, that the medicines that are efficient, that are prescribed based on the clinical specifics from 6 to 9 months. So the use of those medicines started with pilot project in Ukraine, and now we switch to a routine basis, and it demonstrates pretty good results. Most frequently, the most frequent problem in finalizing the treatment course is the necessity of social accompaniment, because we know that everybody can get sick with tuberculosis, and if a person is an active user of injection drugs, for example, or a patient from groups of population with difficult access, they can interrupt their treatment without social accompaniment. So the efficiency of the treatment will not only depend on the name of the medicine, but also on the quality of social accompaniment provided to those patients. So hopefully, thanks to the donor funds, those medicines will keep coming to Ukraine, and further on we'll have more opportunities to procure them, so maybe even under the government procurement programs. But currently, thanks to donors, we have free procurement of those medicines at their cost, and currently we can provide them for free to the tuberculosis treatment institutions. Thank you, Mr. Ihor. Mr. Yana, let's talk more about the situation in the regions. Basically, we see that the situation is different by regions. So what is the overall picture, and how is awareness being raised both in doctors and patients with regard to the new approaches to the treatment? Well, for the time being, the situation is quite complicated all around the country, but the regions with the biggest tuberculosis burden are Odessa, Dnipropetrovsk, Kirovohrad, Zakarpattia and Volyn regions. But again, I need to emphasize that for the time being, given the full-scale war, the ongoing stress, ongoing staying in the basements, like the economic condition of the population, the growth of poverty, we need to emphasize that currently our country is one of the countries with the high rate of disease. And as Mr. Volodymyr has mentioned, what is inherent in Ukraine is the resistant tuberculosis. So it's important to apply for medical aid quickly, because tuberculosis can be treated, and it all depends on the compliance of the recommendations of doctor by a person. So basically, all of the tuberculosis centers are involved in this innovative treatment. All of the medics are aware and trained to do this, there are not only awareness campaigns going on, but also there is like the same type of work on raising awareness is going on a regional level. Within the last couple of months, there was an awareness campaign as to the prevention of tuberculosis, the symptoms. We make people aware that tuberculosis can be treated, because in conversation with some patients or even medics, we find out that there are cases when people just do not know that tuberculosis can be treated. It's like it can only be kind of calmed down as a chronic disease, but again, we urge everybody to apply for this modern treatment that yields pretty good results. We see it's a standard practice of treatment, and the efficiency rate is 89%. But another second trend that we're observing is that the significant number of patients find tuberculosis in pretty neglected form, and it's difficult to treat them. People were not applying for medical aid during the COVID pandemics, and some people just apply for medical aid too late due to the restriction of the medical system functioning due to the war. It's like 20% of the population in the occupied territories still have or in the areas with active battle operations, they have poor access to the medical services, and to make them more easily available for the citizens, we take all reasonable efforts to make them accessible to the population. We implement mobile labs, mobile PO box. We try to help people to identify tuberculosis on early stages, and within the year 23 we've identified that the midterm of prescription since the moment of identification of tuberculosis is 6 days. It's a pretty good indicator given the logistic restrictions, number of air raid alerts that we experience, but still we want to make this figure smaller, so right after identification of the symptoms, to make sure that a person can get the treatment prescribed to prevent the further transmission of tuberculosis. So 2 to 3 weeks of efficient treatment is enough to make a person not contagious for the others. Thank you very much, Ms. Yana. Ms. Darina, Ms. Yana has mentioned that the factor of the full-scale invasion really has influenced the provision of aid to the patients. Specifically in Cherkasy region, there's a lot of internally displaced persons. Part of those people either got infected with tuberculosis staying there, or either got their treatment interrupted at their place of residence. So how should they apply for treatment in their new place of residence? Yes, the Cherkasy region is on the crossroads of evacuation of internally displaced person, and for the second year in a row, I think it's a challenge. Our region is responsible for proper screening of internally displaced persons. They come in big numbers. Some of them stay in Cherkasy region, some of they left for other safer regions of Ukraine, and thanks to the intense support of international donors, of the local and central government, in the region there is interaction organized between the healthcare service institutions and non-government institutions to arrange the proper screening of internally displaced persons. And thanks to that, in the year 2022, among those people, we were able to identify 36 persons. In 23, there were 28 persons requiring physiatric aid. So what do we do to ensure this in the region? We organized the family doctors' visits to the places of temporary residence of internally displaced individuals, internally displaced persons, re-forwarding them for further examination to the specialized institutions and tuberculosis Central Hospital of Cherkasy region. So we have patient-oriented models implemented with a short treatment periods, and we were able to achieve quite high indicators in terms of efficiency. Sensitive tuberculosis is being treated with the efficiency of more than 80%. Chemo-resistant tuberculosis is treatment with efficiency of over 70%. And based on my personal experience, like 5 to 10 years ago, such indicators were lower. And I think that given the circumstances the country ended up in, us as doctors ended up in, and our patients, well, that's quite a breakthrough in the area of tuberculosis treatment. Talking about where should internally displaced persons apply, so I need to emphasize that it's not important from which corner of Ukraine you move to which corner, but if you experience any symptoms of tuberculosis or you want just to get examined, it's sufficient to just come to any pulmonological center where you will be diagnosed and provided the opinion in terms of necessity of treatment. The treatment, by the way, is free in Ukraine. Also, the people can apply to a family doctor who will prescribe relevant examination. So for internally displaced persons, it's desirable to have the declaration entered into with this specific family doctor. Yet another situation is if a person started their treatment in a different region and now they are forced to move to another region of Ukraine, so it's no problem either, because a person who is already getting treatment may just come to the regional pulmonological center where they will be provided with relevant support and treatment. So I want to emphasize that it's not necessary to have any medical documents with them. The medical information systems implemented in healthcare sector allow providing proper aid to any patient without any excessive effort. Yet another option is to come to a family doctor who would be able to continue the prescribed therapy in another region and to ensure accompaniment all the way until the end of the treatment. Thank you very much for the clarification. Dear journalists, do we have any questions to the speakers? Good morning, Natalia Malchanova, Ukrinform. Mr. Ihor has mentioned that among the reasons of failure to vaccinate the children is the refusal of parents. So how frequently do the parents refuse, and what are the other possible reasons? Maybe the amount of vaccines is not sufficient, or probably there are other problems as well. So there are probably two factors. First, it's due to the mistrust in vaccines. There's the official refusal, that official paper actually that the parents are supposed to sign. So basically within the last 2 years we were not witnessing the lack of vaccines in any healthcare institutions. There were no problems with vaccinations according to the vaccination calendar, and the amount of vaccines imported in Ukraine is sufficient until the end of the year 2022. So also there are some medical conditions. For example, children after the birth may have some health conditions that do not allow them to get vaccinated before their condition is stabilized, or they may have some permanent medical conditions like difficult diseases where when vaccination cannot be done. Talking about the percent of refusals, fortunately it's not such a high percentage, but still it exists. In average it's about the level of 5%, up to 5%, depending on the region. Frequently it's tied to the to sub-settlements, because as we were able to observe even during the COVID pandemics, the high level of people who did not want to get treated were among the Roma population and the adherents of or congregations of Moscow Patriarchate. Among them, the number of refusals is the highest, but they get included during the catch-up vaccination campaigns. We still try to cover them using other methods. There we use other approaches that targeted work with territorial communities. Thank you very much. Do we have any more questions to our speakers? Well, in case we don't have any questions, I would like to thank our panelists. Let me remind you, we were talking about efficient treatment of tuberculosis and modern practices which are used in treatment for Ukrainians, and Ukraine Media Center Ukraine Forum will be back on air just in half an hour. We will talk about the hostile strikes on the Ukrainian energy infrastructure. Stay tuned.